So I'm joined today by Dr. Richard Johnson, the interim public health officer here for Nevada County. Thanks for joining me today, Dr. Johnson.
Thank you for having me, Cole.
Yeah, absolutely. I think the first thing I wanted to talk about is to see if we could get a little bit of an update on the technical issue through the state that they were having with that. Do we have an update at this point?
Yes, a lot has been going on in the last couple of days. Back on July 25th, it appears that what's called the CalReady system, which is the data system that is taking care of submission of all of the laboratory reports electronically, which then gets sent to the individual counties of residence of those individuals, that broke down. Essentially, this is a system that's 15 years old, which in information technology worlds is ancient, right? And the second thing is it was not designed for a pandemic such as this. It was designed for taking care of tobacco cases or sexually transmitted disease cases, hepatitis A, related to a foodborne outbreak, things like that. But the number of tests involved and the length of time that this has been going on just overwhelmed the system. So the system crashed. So that happened on July 25th. It took them a week or so to identify what the problem actually was. By Saturday, 2 days ago, they had that fully identified and we're taking steps immediately to go ahead and fix it. And we hope by the end of the day today that we will have accurate reporting because they expect to have about 250,000 to 300,000 tests dumped into the system and successfully transferred to the individual counties by today. And so it'll take a day or so for the counties to process all of that data and update their own facts in terms of the number of cases and the positivity rates and things like that before we can have some accurate data. So what's good is that the problem's been identified, a fix is happening, and we should have local accurate data soon. And then obviously a long-term fix is needed to keep this from happening again, because obviously this problem is not going to go away today or tomorrow.
Yeah. Very true. Do we at this point have any sort of estimate at this point as far as how that's going to affect us, or like an expected amount of extra cases or tests that seems to be missing?
Sure. For Nevada County, what I've heard so far from our debriefing this morning, just an hour ago, is that they've identified at least 30 positive cases related to Nevada County. Now, unfortunately, some of those are old enough where it's really past the time for us to take action because isolation periods of 10 days and quarantine periods of 14 days may have already passed in relation to some of those tests. So our priority would be to take action on those tests that are the most recent, where we can actually make a difference in the community transmission by taking action now. The older ones, we'll have to let that be and have lessons learned basically from this, but we'll act on the new ones and do as much as we can to limit the community transmission. So we've been flying blind a little bit for the last week or so, but I think we're at a point now where we have the staff and the staff time and capacity and capability of getting a handle on this pretty rapidly.
Gotcha. Okay, that's great to hear. With a similar sort of issue, I think there's been reporting that the lag time in terms of testing had increased to the point that it was maybe 7 days, 10 days, and encountering the same sort of issues that you were just talking about in terms of they've already recovered by the time we even get the test results back. Have we been able to start resolving that issue as well?
Yes, lots of activity happening both locally and at the state level. In terms of that, the state has reorganized their testing task force with new leadership in order to go ahead and look at what options are available to solve both the staffing issues and the supply issues, which have resulted in the long delays with testing results. Because as I just referred to, if the isolation period's 10 days and the quarantine 14 days, if you don't get a test result back until towards the end of that, or even after that in some cases, the opportunity to do something to limit community transmission has passed. And so there are rapid tests that are available that some folks in the county are using, where those are point of care tests where you get the result in 15 minutes. There are some labs which are able to give us a turnaround time of less than 48 hours. We are exploring other options for various facilities and agencies to get testing done in that 48-hour time frame, because that's really the goal. The goal is to get testing done in 48 hours and to complete the case investigation and contact tracing initial work in the next 48 hours. That's the window where we feel we can make a difference in what happens in our community. So yes, lots of options being explored. And so we hope for the best with that, but obviously we still have a ways to go, because what this lacks is a national strategy, basically. And so we, again, are in the situation where the systems in place have not been able to handle and sustain the workload that has been presented to us in terms of requirements for testing. The goal really is to have point of care testing at the doctor's office, at the urgent care, at the emergency room, at long-term care facilities, so that testing can be available right there within minutes rather than hours or days or weeks like we face now.
Gotcha. Okay. Yeah, that would be fantastic.
Yep, that's the goal.
All right.
We're working to get there.
Can you mentioned contact tracing a little bit. I'm sure some of these issues that have come up have sort of limited your ability to do that to some extent. But can you tell us a little bit more about how the contact tracing is going? And if possible, maybe even give us a little bit of information about the types of circumstances and if there's been some sort of consistency as far as whether we're seeing a lot of cases in particular places or through certain activities?
Sure. The thing that we are most worried about is the continued existence of what I'm going to use the term gatherings. When I use the term gathering, somebody says, well, how big are you talking about? Are you talking about 10 people, 25 people, 250 people? Obviously, we're not talking about a Sacramento Kings game with thousands of people involved, but we're talking about small groups, basically. And the key is not to think about a number, but it's to think about how many households are involved in a gathering. Because if we are essentially quarantined within our household, and then we get together in the name of a barbecue, a birthday party, a family reunion, whatever it might be, whatever the excuse is, we increase the risk tremendously. And that seems to be what's happening. Even though we do have a state order to stay at home and banning of non-essential travel, all you need to do is get out on the highway or go to any campground, and you will find the places are overrun. There's nonstop traffic on the highway. Campgrounds are full. People have resorted to dispersed camping because they can't get into campgrounds. People are moving around. And so it's people, movement, and gatherings that is our biggest fear. And that is something that public health is struggling with. How do we go ahead and control individual behavior? We can't control it, but we would love to influence people so that they can behave in the way that limits the risk to themselves, to their family, and their community. That's really the key. That's happening both on the west side and the east side of the county. A month ago, you would have found that the east side of Nevada County was leading in terms of the number of cases. And that's really significant because that part of the county has less than 20% of the population of the county, and yet had more cases than the west side. However, in recent days, the west side has taken over, and part of that is gatherings, part of that is congregate living centers on the west side, where we have begun to see some outbreaks in skilled nursing facilities, adult living facilities, and memory care units. And so that's really a concern, since congregate living facilities, whether we're talking about a jail or a prison or a college dormitory or a skilled nursing facility or memory care unit, those are all very high risk. And so that is really a concern for us. But gatherings is what the general public needs to really pay attention to. And the other important points are social distancing, 6 feet. That's incredibly important. We know that the virus spreads much more easily inside than outside. So by all means, as much as possible, spend your time outside. We know that face coverings are helpful to reduce the spread from you to somebody else, and probably also in a little bit reduce the risk to yourself also. And so those are the important things, in addition to hand washing and so on, that we emphasize. But it's really all about people movement and gatherings. That's our biggest concern.
Gotcha. Okay. And you sort of touched on what was going to be my next question a little bit, which was about the senior care facilities and the fact that we did just recently start to see maybe the first signs of a little bit of an outbreak in that community, which would be a big concern for us. Can you give us an update on that certain situation?
Yes, and you've probably seen around California and around the country, many skilled nursing facilities have been impacted by this. Up until this point, Nevada County has been blessed without much activity in those centers. However, in the last week or so, we have seen more activity now with up to 23 individuals at one site, including staff and residents of that facility impacted by that. Our staff is working closely with the facility staff, as well as receiving assistance from the Hospital-Acquired Infection Program in the California Department of Public Health. So it's a team approach to go ahead and try to limit this impact on those vulnerable residents because of their age and their comorbidities, their underlying medical conditions, as well as the staff. We're concerned about all of those individuals at this point and doing the best we can to work on that. And we do have the capacity, we do have the staff to deal with that. We have good communication with these facilities, but this virus is incredibly transmissible, very easy to spread from person to person. And since a large proportion of individuals are asymptomatic, it's sometimes very difficult to identify who it is that might have spread it into a facility or a household or a neighborhood or a school or whatever it might be. But we are working hard on that and hope to do the best we can to limit further transmission and consequences in these facilities.
Gotcha. Okay. Do you have anything else that you'd like to add or that you think the community needs to be aware of at this point?
Yeah, there's lots of discussion in the community about the issue of rights. And so I'll bring it up. It's a political issue. Our decisions are based upon science, and as much as possible, we base our decisions upon the evidence that we have at any given point in time. And obviously, the evidence today is very different than it was back in February and March. We've learned a whole lot about this virus. We have a tremendous number of questions that are still unanswered that we need to learn. What we need to remember as individuals, we have rights. Yes, when we drive on the highway, we do have a right to drive on the wrong side of the road, but there are consequences to that. We have laws about helmets and seatbelts, and people choose not to wear them sometimes, and there are consequences not only in terms of fines, but also in terms of injury to yourself and to others. And I look at this virus in the same way. We do have rights, but we also have responsibilities. When my rights begin to infringe on the right of somebody else to stay healthy, then I've got a problem. And that's the balance that we're trying to achieve, to go ahead and help both our economy to stay healthy and our individuals. And for us in public health, the individuals are the important ones, of course, but obviously anything we do for individuals does impact the economy. And so we're trying to achieve that balance. So I would just plead with people to pay attention to what's going on, to pay attention to your own individual behavior, because that's what you are responsible for, and that's what you can control, that of yourself and your household. So I appreciate everybody's help in this. This is about all of us. This is about our families and our community ending up coming out at the other end healthy.
Perfect. Yeah, I totally agree. Can I have one more add-on question to that, which is
Sure.
where should we be going to try to get the best information possible? And how do we go about evaluating all these different new sources of information that seem to be coming out from all over the place? How do we figure that out?
Yes, there's a tremendous number of sources of information. So I think the Nevada County website is one good place to start. The California Department of Public Health has lots of information on it, and the CDC. Those are the three places that I would start. Johns Hopkins has good data about statistics and research and lots of papers and lots of information. But then again, there's lots of other sources of information out there. But I would read between the lines. Who's saying it? What are their credentials? You know, what's the evidence that's backing up what they say? Those are the important things. So I think a lot of it is about trust. You have to trust in somebody, because if you trust in somebody, you're going to believe what they say, and that is going to influence your behavior. And so you've got to park somewhere and put your trust with somebody, and hopefully that will be with the folks in Nevada County and at the state who are working hard in your best interest. So thank you for the opportunity.
Absolutely. Thank you very much for joining me today, Dr. Johnson.
Okay, thank you, Cole. Appreciate it.